Good evening, everyone.
Good evening.
I'm just gonna wait for the others and then we'll start for the introductory class, okay?
Okay.
Let me, because I have another class also. Let's discuss. So PCE written classes, basically what I am providing. For your PCE preparation, you have to go through the everything. Now, first is a concept. Concept is must. If you have no idea about the theoretical framework, it is difficult to go with the questions. Ultimately, we are end up with the 200 questions. And we have to give answer for the 200 questions. But that 200 questions, we have to understand the concept. Okay, so basically, first theoretical round, that is our regular theory classes, that all clear your doubts regarding theory. And this theory, we don't have any shortcut, please. We have to go with the book wise. Yes, my PPTs are available. My lectures are also book related. So if you go through my lectures and then read the book, it is very easy for you. I'm sure. It is very, very easy for you, but you have to read again and again from the book. That is very important in your preparation. Sorry. Yes, sorry. Once your theoretical class, once your theory is clear, it is very, very easy for you to understand the correlation. So theoretical class is very, very important to understand the whole aspect. Anything, like for example, I am going with the simple elbow joint. Very simple, elbow joint. So it is the MSK. In the MSK, what are the topics we have to cover? I'm going to discuss right now. But that elbow joint may be associated with the rheumatoid arthritis. That elbow joint may be associated with the hemophilia in your exam. That elbow joint may be associated with the pediatric population, that supracondylar fracture or pulled elbow. So any of that thing, just a minute. Just a minute. It's Toronto morning time.
No, ma'am, it's night.
No, I mentioned Toronto morning time.
I think in the group, like you mentioned AM, that's why.
It.
Yeah.
When you messaged the privately at that time, it was showing the 6:30
You need to
a.m.
ask me double time because if I'm mentioning this thing. Anyways, we have our recording lectures. Let's go. Okay. So the thing is, we have to go with the theoretical portion where one joint. First, if you have an idea about the elbow joint, then and then you can correlate with this topic. Rheumatoid arthritis, hemophilia, pediatric population. But if you have no idea about the elbow joint, then if any questions comes, you are like just here and there. So basic thing is first clear your concept. That is the thumb line rule. Okay. And once concept is clear, then you have to go with the correlation, means you have to go with the question answer. As many as questions you are doing it, you get confidence in your exam. Even though you are master in your theory, but if you are not doing question answers, you are not ready for the exam. This is as a simple thing as is theoretical concept. It is needed to understand the questions and preparation with the question answer, which is needed for your exam. And that question answer preparation that covers in our mentoring batch. So this is very, 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 very important. Let's wait for like 5 to 10 minutes. See, whenever now I have a mistake like this, just revert me back.
No, ma'am, you have mentioned like morning from there, Mumbai. It's not here. It's written like 6:30 a.m. from
Indian
Mumbai.
time, yes, but Toronto time I mentioned as AM by mistake.
Oh, okay.
That's why everyone has a problem. So this is very, very, very important. Any question from your side, then we will discuss in our lecture. What you want to know, Vedant? And what you know about PC?
I have heard about my friends that who have cleared the PCE, that about the simple superficial things like there are 400 questions, we have the time and everything, and we have to study deeply with the anatomy, physiology, and whatever the book that covers the all these things. We should read the deeply. Anything I don't know regarding.
That's
Yeah,
it. That's more than enough. Hina,
yeah.
you already in this queue. What you understand?
Oh, ma'am. It's a long journey. That's what I understand. And we have to like revise regularly. Otherwise,
That's correct.
yeah.
Revise
And
regularly, even though you are done the topic, you have to go through and through. Okay. Yes.
yeah. And they would confuse us with ethics. So that is must part.
Ethics is your core. Okay, now let's go with the thing. How to prepare. So regular classes, that is, I already told you, this is a theoretical class that covers your concept for reading and mostly the topics from the book. Right now, what I'm doing, I'm just clearing your idea about PC. So concept is going to be cleared. Simran is concept must be cleared, but then that concept you have to revise again and again to make it concrete. It is not like just one time you read the thing, you are done. No, it's not like that. Sorry, Simran, my bad. Welcome.
It's okay, ma'am. No worries.
Okay, so we are just discussing. So how to prepare in the PC? PC, basically the regular classes provide the theoretical framework, clear your concept about the reading, topics from the book. And for PC, first we are going with the topics. MSK, Neuro, Cardio, Pulmonary, Pedia and Geria, that is the population, other system, and ethics. Ethics is the core. You know, for our living, we need oxygen. For our PC, we need our ethics. So ethics is the very, very, very important thing, correlate with any question. Because Canadian physiotherapy regulator wants ethical physiotherapist. So we have to go with the ethics. Our ethics are so clear that you must know that, okay, this is ethics. First questions are appear. Don't think that it is MSK question. Think about that. Where is there any ethics associated with that? Yes, think and then go with the topic. So overall, MSK, Kishner, 7th edition, that we need it. Maggie and therapy ed. Therapy ed, I prefer like do old version, which is little bit more detail with the pulmonary portion. I'm going to explain whenever there is the need for the old version, new version. New, if you have it, paper book, very good. If you have a habit to read from the laptop, it is more beneficial because in exam you have to go the online, right? So it is more beneficial. It is up to you, whatever you prefer. I prefer paper based, even though right now also I have a paper based book. Everyone has their own way of technique. Don't change the technique. Only when you are doing question answer, try to do the question answer online. Do not make a notes and all these things, or do not go with the paper based question answer on the screen. Otherwise, everything, whatever you prefer. Neuro, Sullivan is our Bhagavad Gita. So Sullivan is must. Cardio, you are going with the Sullivan, therapy aid, and Raden Chung. Pulmonary, red and chung, therapy aid. Therapy aid is the most important. That's what I feel. Another book is Hillgrace and Goodman. I'm providing this book, but Hillgrace and the Goodman, very detailed. So if you want to get detailed idea, to know something, yes, you can do it. But for PC exam, if you read these two books, more than enough. Pediatric and geriatric therapy aid, very, very important, very, very important. If we feel that, okay, what happened in the geriatric? No, geriatric also has a lot of things. Then the other system also we are doing with the therapy aid and ethics. So my theoretical classes are different. My batch is divided into the 4 component. Theoretical classes, ethics, that is a 12 class, mentoring, mock exam. Theoretical classes, I try to cover most of the things. Few things that you have to cover, I will explain that topics. For example, aquatic exercise. So I'm gonna again and again doing it in the classes about buoyancy, hydrostatic pressure. But in depth, if you want to read, go and read. So small topic like scleroderma, psoriasis. So that topic is like just one paragraph. So that one you have to read it, but I'm giving the topic that this topic you have to cover if you have any question. Otherwise, most of the topics I'm going to cover, I'm not going to depend on you because I want you have to be thorough with all the topics. Ethics, periodically I'm conducting the classes, approximately 12 classes. In that one, 9 plus 3, 9 classes recordings are available. 3 classes recordings are not available because that one is the mock exam, like ethics mock exam discussion, discussion about the students' doubts, and then I'm doing rapid fire, like mentoring type of thing. Ethics, some students are already purchasing my ethics class. So 3 classes, you know that discussion portion I'm not gonna record. But every ethics class, so for example, I just done my March batch. Next one is in the May. Every ethics class, I'm revising something which is updated from the college website. So I prefer that you are with me, try to join all the ethics class, even though it is repetition. So it will help you to get the idea. It is helpful for you to get the again revision. It's easy for you to understand. Okay, and every time ethics, something is new. For example, last verse is this time I add the communication strategy, which is a whole one class, 5th number class. Recordings are available for the ethics, that 9 lectures. But college, whatever college is adding every time, I'm gonna try to add in the my new batch. So whenever you are there, try to join it. If not, try to go with the recording with the new version. Old version, I'm always going to delete. So you are always go with the new version. Mentoring. Regular class approximately 3 to 4 months, and mentoring I want 4 months, 3 to 4 months. It is depend on the student's capacity. Like my one student started with me on March and she cleared on November. It is depend on the student's efficacy. What I see, students are joining with the full motivation and all. Keep maintaining that motivation is difficult. So guys, focus here. Try to maintain this motivation. It is very important to clear the license, and it is very easy. Only the thing is your study, your consistent study, your approach, your strategy, and that's it. And then finally the mock exam. Mock exam, I prefer mock 1 and mock 2, which is exactly the Vignet style 200 questions. But also I see that students are weak with the intervention. They know everything. What happened in the Parkinson, rigidity, bradykinesis, and all these things. But what about the treatment? PNFD2 flexion, PNFD2 extension, then it's gone. So intervention, what we are for? That portion is very important. So I divided, like, particularly I have an intervention exam for 100 questions and examination questions 75 plus ethics 72 questions. So ethics questions, mock test, that is in the ethics class. But overall, I am providing this thing. Plus mentoring, continuous flow of question answers. Because once your concept is clear from the theory book, then if you are not doing question answers, you are not confident for your exam. So you have to go through your question answers regularly. Questions throw and you understand, okay, what the question says, where to look, what is the keyword, and that practice comes when you are doing the practice. That confidence comes when you are doing practice. Otherwise, you are just blank. If you are not doing question answers, guys, you are not going to clear the PC. And if you are doing only question answers, that is also not good. So we require both the things. There is no shortcut. Only one exam, and imagine you are going for the third trial, so you have to go with that. Don't think that it is your first trial, second trial. No, it is only and only third attempt. After that, you have no chance to become a physiotherapist. Prepared like that way. And before going for the exam, for example, if you are thinking you are going for the next March, before going for your exam, are you ready for February? Like in case exam is preponed, are you ready for that? Yes, then go for the March. Otherwise, don't go. With confidence, without hesitance, if you are sitting in the exam, that is your success exam. But if you are going with just, I have to do this, I have to do this, last moment you are running for the topics, you have a 1 year ago, everything ready, and you are not doing, and on the last moment, if you are doing it, it is meaningless. You have to go with your full preparation. So do it with your full preparation, very beginning. Every time make a notes, revision makes you more confidence, and then question answer. So this is overall thing. Regular class is what you gonna cover first. So you're gonna go through the book. Don't think what they are asking, because sometimes students get the questions and okay, this is not necessary. In exam, you have 200 questions. Maybe like you are not getting whole vignette for Parky. You are not getting whole vignette for shoulder. That doesn't mean that you are not doing it. You have to do it. We don't have shortcut. So we have to finish everything. Whatever they want to ask, they ask. Right? We are not just preparing ourselves for the 200 questions. We are preparing ourselves for the registered PT. And we are not preparing ourselves for the 600 point. Now, what is the exam? 200 questions. You have a 4 hour. Now here, one more thing. This is the preparation, and what you have to ready, you have to ready with your time management. Time management is the important thing. It is totally out of your physiotherapy. Time management means right now also, are you working? Yes. No need to bother that, okay, I am working, that's why I cannot prepare. Come on, you have a 24 hours. 24 hours, you are 8 hours working. Commute time is, oh, I can understand 1 hour. Total 10 hours working. Out of 10, 24, 10 minus 14 hours you have. And 14, if you have enough sleep for 6 to 7 hours, you have a 7 hours. Now you have to manage. At least you can spend 5 hours daily. Weekly, it is 35 hours. But students has no time for 2 hours only. Students are thinking that, oh, I have no time. Why no time? Because you are not doing management. You are not making a schedule. You are not running with the time. Every time the wristwatch is on, you are not running with the time. That's it. Time, everyone has enough time. If everyone say that I am so busy, that means useless. Kids, not kids, having a kids, yes, I understand. But that doesn't mean that kids are their strength. Kids are also doing their work. You have to prove yourself. If you have no kids, good. At least you have no tension. If you are not married, very good. But everyone has different scenario. If they are not married, they have their own stuff. They have to do everything. If you are married, you have a partner. Everyone has a plus point. Everyone has a minus point. You have to arrange your points and you have to do it. But I want minimum 5 to 6 hours preparation when you are going with the theoretical class. And then mentoring 8 to 9 hours, and then gradually increase by 10 to 12 hours. Reduce your sleep hours. That's okay. Enough sleep is okay. Enough sleep is mandatory actually, but not like you are sleepy all the time. So management is first another portion. Second thing is timetable. Third thing is exam. 200 question. We have a 4 hours. 1 hour, 60 minutes. So we have to practice 1 minute, 1 question. That way, in 1 hour, you are able to do 60 questions. So at least your speed is 4 hours, 240 questions. Instead of that, we have only 200 questions. So by mistake or because of hard exams or anything, if 40 questions are so hard, at least you have a double time to think. And do not give answer in so fast. Sometimes, I see the students, they give answer in 30 seconds. Why you are doing hurry? Read question 2 times, even though you know the answer. Appropriate time is important. Not too fast, not too slow. Sturdy speed. So that is your time management for your preparation. Okay. So this is one story. Books. We are going with the books. My lectures are so easy. If you go through my lectures are from the book. Each and every line from the book. And once you go through my lectures, you understand the book easily. But if you go through my lectures on Monday and you started your book from after 15 days, then it is no point. Be parallel with me. And I'm sure upper extremity you are parallel with me, lower extremity gone. So that is my observation from my batch. Right, Ina?
Yes, ma'am. It happens a lot.
So because see, my portion, I'm gonna done within 1 week, I'm done with upper extremity. But what about you? You have to go through it, okay?
Yes,
What is
ma'am.
the PC? So PC is a correlation of the topics. PC is not like just you done shoulder joint and PC is asking shoulder joint promptly. It's not like that. Focus on the topic, read associated things too. Now that comes in your mentoring. That's why for my regular batch, I'm not dividing my fees with this. Because to clear the exam, student needs everything. Student needs the concept, student needs the mentoring portion, that they are ready for the question answer. They are ready for the correlation. This exam is not only just, you know the question, you know the answers and done. No, you have to become ethical physiotherapist with practical scenario. That okay, if the patient is coming to you on that given situation, if you are actual physiotherapist, what happened? What you gonna do it? If you are a physiotherapist, child is asking what happened to me, are you able to reveal the diagnosis? If he's a 10 years child, 12 years child and the ethics, PCE ethics is totally different. It is not related to any other country's ethics. It is their own ethics and we have to follow that ethics. If any person is asking diagnosis, physical diagnosis, yes, but the overall main concept diagnosis, you cannot relieve the diagnosis. That is a physician duty. We have to collaborate other healthcare workers as well. If patient require the, for example, swallowing problem, so we have to refer them to the speech language pathologist or the occupational therapist. Appropriate healthcare worker is required to achieve the best result. And we have to work with the patient-centered approach. So this is the correlation. And that I covered in mentoring. Now, focus on the topic. So that's why I'm just giving one example here. See, in the theoretical class, I covered the shoulder joint. Maybe I am taking some points for the posture, but posture is my another topic. Posture I am covering in the spine lecture, but posture is a totally different topic. Shoulder joint is a totally different topic. But when the question comes, it comes with the forwarded posture with the shoulder joint. Anterior tipping, kyphotic posture, shoulder joint. COPD patient. So COPD patient always has a tendency to use the accessory muscles and kyphotic postures and the shoulder joint. So you have to be correlated. Okay. Scapula, hemiplegia. Hemiplegia, one side paralysis. They also have the high chances of the shoulder dislocation, scapular retractor spasticity, or scapular internally rotated scapula leading to the abnormal glenohumeral rhythm. Think everything when you have a question. So for that, your concept about the theory must be clear. And in mentoring, I'm covering that correlation. So this is, I'm going to explain what is mentoring. Okay. So this is overall your stuff, how to prepare yourself for the PC. Now let's go with the topic. Let's think about the theoretical concept first. So MSK, we are working with the peripheral joints, spine, in the spine posture, spinal conditions, TM joint. In the MSK, actually it is the other portion, but I covered in the MSK, orthosis. What is orthosis? It support the weak structures. So orthosis is a splint. Orthosis is useful for the upper extremity, useful for the lower extremity. It is associated with the peripheral nerve injury. It is associated with the neurological conditions. So orthosis, traumatic like amputation, remove the body part. In the orthosis, original body part is present and it is supported by the splint. Amputation and prosthesis, original body part is not present. So your treatment is totally different with the gait training. And then I covered the gait. Actually, I'm not taking gait early. I'm taking the gait later. But gait, what is a normal gait? Abnormal gait. Now, abnormal gait has 3 types. Actually, 4 types. Abnormal gait due to the MSK condition. MSK condition means hip abductor weakness. They have a 10 lumbar gait, lurching gait. They have a, I can say, GPS patient. Quadriceps weakness, poliomyelitis, quadriceps weakness, drop foot, dorsiflexor weakness. So this is MSK related conditions and the gait deviation, gluteus maximus weakness, hip flexor contractures. So these are totally MSK related gait deviation in the stance phase, swing phase. Second concept, orthotic gait deviation. So patient has original weakness plus orthotic, some deviations are there leading to the gait abnormality. Prosthetic gait deviation. Original limb is not present. Whatever transfemoral or the transtibial prosthesis is given, which is inappropriate. For example, heel cushion is too soft, heel cushion is too hard. There is a, I can say the knee bolt or the hip is, heel portion is inwardly rotated, externally rotated. And what is the abnormal gait deviation? We will discuss. But that is a gait. And fourth is a neuro. Parkinson patient, gait deviation. Spinal cord injury patient, L3 level, gait deviation. ALS patient, MS patient, ataxic patient, pediatric population, CP child, hemiplegic patient. So that gait deviation. Neuro, I'm covered in the neuro topic. But these are the, when you are making your notes, make sure that gait, it's easy. If you are go through the smart way, it is very easy. But gait, what is the normal stance, swing? What are the normal muscles? What are the normal angle? And then abnormality. That's it. Osteoarthritis, rheumatoid arthritis, osteoporosis, which is associated condition. Rheumatoid arthritis, flare up action, and sometimes there is no point. Only I have a rheumatoid arthritis, but right now I have no pain. And today, next day, I have a swollen hand. So rheumatoid arthritis, depending on your vignette, depending on your scenario, you have to think. But before that, what is the difference between OA versus RA? OA morning stiffness is less than 30 minutes. Rheumatoid arthritis morning stiffness is greater than 30 minutes, approximately 1 hour. Osteoarthritis cartilaginous involvement. Rheumatoid arthritis synovial involvement. Systemic disease, rheumatoid arthritis. So that concept must be thorough. And that comes when you are doing revision. One time reading is not enough. Osteoporosis, it is the associated condition. It associated with any of, like even youngsters also have the osteoporosis. Osteoporosis and geriatric basically. vertebral fractures. So that is important. We will discuss, but that is also take it in the MSK. I'm always taking in MSK. And other MSK conditions, osteomyelitis, sleep capitis epiphysis, Perthes disease, avascular necrosis. That is in the hip also, but other MSK condition. It is not like frequently seen. What others? Osteogenesis imperfecta, Paget disease. So these are the other MSK condition you can find from the therapy aid as well. So these are the few books, which is very, very important. There are also other books. It is mentioned on the website. That is also good to go through. But overall, I prefer that if you go through these books, it's easy for you. Any question? Or is just one-way lecture?
Hi, this is Forum. Are you providing like soft copy of the books or any PDF
Forum soft
version?
copy of the books, it's I'm going to answer afterwards. Soft
Okay.
copy books, you have to go through by yourself.
Okay.
Okay, but I'm providing the name of the books. Okay, once lecture is done, I will give you the answer.
Okay, no problem. Thank you.
Yeah, any other question?
And
I'm providing the whatever lectures we are doing it, theoretical classes that convert into the live lectures are there, that convert into the recording. That recording you can get access until your first exam. It is not time bound, that 1 year.
Okay.
Okay, it is until your first exam.
Okay,
Second
perfect.
thing, PPTs. My PPTs always you can get the access until your first exam. Ethics, recorded classes, yes, 3 classes I am saying that. Mentoring, I am not providing recording lectures because I want students must be present with me. If you are getting recording, you know what? My regular lectures, hardly I'm getting few students. I have a full bunch of the batch, but they know that Mamta provides the recordings. Right now, see, we have a regular student batch and recording lectures are available, then they are not bothered. But
Okay.
what they go through recording, what they understood. If you are right now live, I know you have one concept about book. You can ask me directly. But if you are not in the live, whether you understood, whether you are not understood, and when you are go through my recordings and you write it down your points, and when you are asking me, I will give you the answer, time taking.
Yeah, got your point. Yeah.
Right. So
Yes.
I want everyone live, but if by they are doing job, they have their own timing. Recording lectures, you are going with the theoretical recording lectures with your convenience. I am okay. Mentoring, I am not okay. Because mentoring, I want my each students live with me. I have a limited batch. And I want strength, as a teacher, I have to know my students' weakness and my students' strength. Otherwise, if I am not doing question answer, I have no idea. See, Vedant has a friend, Vedant has that friend cleared the exam. Still, he has less idea what is in the PC. Example. But overall, when you are done your joints, you are done with this and question answer, you are not there. You are not in mentoring. How I can understand that what you understand, where you are wrong with your thinking, and where to focus in the keywords. So mentoring, not recording is recording is not provided. Live lectures, yes. If you miss that one, I'm trying to cover up with the other batches as well. But live. Okay. And mock exams always. Mock exam, even intervention exam, I'm discussed with even though you have a rational, I'm providing the rational for the answer. Still, I'm discussing with my students that, okay, why you are thinking these answers and why you are thinking these answers. Because one word is changed, your answer is changed. Clear? Okay, yeah. Any question with that?
what would be the passing mark of the theoretical examination out of 200 questions?
We have a 700 point. So 200 questions, it convert into the 800 points. It is the percentile actually. They are working on the percentile basis.
Okay.
There is a calculation, but out of that passing is 600. Okay, now it is a good question. Let me explain that point too. So we have a 4 area. First is MSK, neuromuscular. Second is the cardiopulmonary. Third is other. And 4 is ethics. That way. Okay. So musculoskeletal 55%, cardiopulmonary 15% on an average. others 5%, and this one is on an average 15 to 20% on an average. That is the area, and we have a 7 domain. In that one, professional practice. Right now, just a minute. Professional practice, management, then scholarship, then leadership, professionalism, management, scholarship, leadership, the communication, collaboration. There is one more. Professionalism. Upendra, do you remember one more? Professionalism, management, scholarship, leadership, communication, collaboration, and one more. So this domain is your ethical concept. See, I have a patient who has a frozen shoulder and he's a painter. He has to paint a ceiling. So he has to do the overhead activities. I need to diagnose that he has adhesive capsulitis. That is my professional. One more thing is it is related to the assessment. I forgot the name of that domain. Sorry, but this is something like that. So I need to assess that one, right? So I have to assess. Now this patient has a diabetes. He is 70 years old. He lives alone. His wife his wife is no more. Like he's just alone 1 year ago. So he's little bit depressed. And he's a chain smoker. So this is the conditions are given. So out of that, I have to identify his social negative backgrounds, his personal things, and I have to assess that he has a frozen shoulder, occupational stuff also. So assessment portion, then I'm giving the management that I'm providing. He's an elder patient, diabetes. So first I need to check the sensation before giving any modality. So that is my management and the First, when I'm approaching that patient, I need to do the communication. So I have to provide the informed consent. I have to take the informed consent. I have to provide that information. So that portion, if you have a question about the consent, that comes in the communication. Second, if any red flag before starting the treatment, I'm thinking patient has a continuous night pain, is not relieved with the medication, and patient also has a lymph or the mass in the neck area, I have to refer to the physician to identify the suspicion of the cancer, but I cannot reveal cancer to the patient. I'm a physiotherapist. So I have to say the patient that something suspicious, you have to see the physician, then I will start my treatment. So I did collaboration in that question. So consent, communication point, collaboration is your, refer to the physician is your collaboration point. Physician approve that everything is good. Then you start treatment with safety, check the sensation, use the electrodes, stents and everything is appropriate. That is your management. You are doing everything professionalism. Like you are not talking too much with inappropriate way. You have to treat the patient with the professional way. Then if you have a PTA, you provide all the treatment, okay, treatment plan decided by you, delivered by the PTA, that is your leadership. Because under your leadership, PTA is working. And you are using evidence-based practice, that is your scholarship. So within a 4 questions, your 7 domain is assessed. So in your exam, every area has 800 points. So 4 areas, out of 800, you have to clear 600 points. Average, okay? So average 4 areas, you need to clear 600. That is one. And same way, because this is one concept, or average 7 domain, you get 600. Then you are pass. But I want everyone is working. We are not working for the pass. So go with the 700 point. That is your target. You are doing it, then do it 100%. Don't do in middle, 60%. Do you want to do it? Yes, 100%. You want to do, you don't want to do it, don't start. Clear?
Yeah.
Any question?
Ma'am, what would be the timings for this batch? Like the final timings, what were
Yes,
decided?
final timings I will post in the group. Simran, most probably Toronto morning time is my final timings, because mentoring
Okay.
page I want live lectures and some are working and I don't want to stop them working.
Okay.
Okay, so that mentoring batch I'm conducting in the morning and this. Sometimes Saturday, Sunday I may conduct evening time, but regularly morning time.
Okay, ma'am. Okay.
Okay. And a weekly 3 to 4 lectures initially. I'm trying to cover the MSK portions, like 3 to 4 lectures, because it is a continuation. If there is a break, it is difficult to understand again. So that way, every upper extremity is done, then I'm providing the mini exam for the upper extremity, and then rational. You have to go it. You get the access of the recording. You get the access of the mini mock, like mini test, as well as the rational. And I want you clear your doubt by yourself, so it's easy for you to read the book. Everything, if you are dependent on passively, that is very difficult for you for the exam. So I am there, I am discussing the answers anytime. If you have any question, you have my number, you can post me within a 24 hours, I will answer. But try with me in the lectures. So at least that finish your 4 month, everything, and then you have a mentoring. And if you stop, even though you are continuous with me for 4 months, by something happen, for example, then again you have to start from the scratch. So once you start it, finish it. Okay, tentatively in your mind, timing will be fixed, that if you are starting by April, you are good to go by next February or the March maximum. November is too short time because it is 8 months, but it is depend on your capacity. What is in the peripheral joint? Let's discuss one more thing in the MSK. Peripheral joints, resting position. So every joint, we must know resting position, closing position, and capsular pattern. This is basic. Mobilization, chapter number 5 in Kishner, that portion, early chapter 1 to 11. You have to read it. 14, 15, 16 is the spine lectures. 17 onwards peripheral joint. But for that, you have to read at least once. And when you are go through the books, for example, shoulder mobilization, at least read mobilization chapter. What is the shoulder position? What is the mobilization direction? Everything is not important right now, but direction is important. So direction, position, mobilization grade 1, 2, 3. That is common for all the joints, even in the TM joint. Arthrokinematics, muscles involved in that joint. I want everyone MMT, particular deltoid, serratus anterior, biceps, pectoralis. We have at least one time when you are preparing first time, go with the MMT. Now supply. Origin insertion, that's okay. We know origin insertion. And eventually we come to know that, okay, this is the thing. Origin insertion is important. But if you are digging that portion, you are not digging other portions. So work smart way. Then every joint conditions, identify with the mechanism. For example, fall on outstretched hand, then patient does not have the frozen shoulder. Okay. Patient has a whiplash injury, that patient may not end up with the I can say cervical myelopathy. Rare case, yes, but we have to think mechanism of injury and the condition. Special test, every joint special tests are important. I'm covering the special test joint wise, and in the therapy particularly special test A to Z is given, and that special test with elaboration you can read from the making. This is ethics. So right now you are coming with me. Why you are attending this lecture? Because you have a goal to clear the exam. That is your long-term goal. But for that, what is the short-term planning? That is this lecture. So every patient, whenever you end up with a patient, you must know what is the short-term goal, achieving that duration, and then what is my next goal. That become your best physiotherapist. So exam point of view, you must know. Treated, whether he is conservatively treated. So if it is conservative treatment, acute management, subacute management, return to the function. Ultimately, therapist's goal is to make the patient independent. Now, this patient is, okay, I don't want to dig too much in detail, but along with that, in the ethics, whether it is a patient of WSIB. WSIB is a work-related injury patient. Whether this patient is MVA, motor vehicle accident, and whether this patient is coming as extended health. Extended health means I am the normal person who directly coming to you. So this is extended health. So that also different scenario. In ethics, I'm gonna cover it. But ultimately, my goal is make the patient functionally independent. If the condition is surgically, no surgical, rotator cuff repair, shoulder arthroplasty, elbow arthroplasty, flexor tendon injury, extensor tendon injury, THR, TKR, any surgical. Maximum protection phase, moderate protection, return to the function. Precaution, what not to give is must. Even though you are not a good therapist, but if you must know what are the movement must not be provided. Means you cannot recover, but you cannot deteriorate. Right? So in the exam, I want you must remember what not to given to this patient. And ethics everywhere. So that covered in ethics, but surgical patient, what is the preoperative patient has some concern? What is your scope of practice? After surgery, what is your scope of practice? What is the patient's question? How to address these questions? Never say negative to the patient. Never say negative to any healthcare worker. Like, oh, I know he's a bad guy. No, never. Ethics, professional, everything is always work with the positive environment with going to the patient-centered approach. That's it. When to refer to the physician, OT, nurse, family member, patient himself has question. If patient has a question about his recovery, now he is amputation patient. Am I able to run? Transfemoral patient, am I able to run? How to address this question? So we will discuss this thing, but these are the ethics. And you end up with this ethics, be ready with that. So rather than having a fear and you read, first be confident that I am doing in the proper direction and then focus on your study. You are the only one to help yourself. Okay, I am just guiding person. I am guiding with my best way, but I am the guiding person. You are your own teacher, you are your own learner, and you have to compete with yourself every day. Be a next version. Every day, something new in yourself. That is your key to achieve the success. It is not like, okay, I have to do this. Oh, it's so much stress. It's too much. Nothing is too much. Everything is already we are doing revision. 4 years we did bachelor. Some are masters also. So now why you are worried? Everything we already done. This is revision. Okay. So we have to do very particular way and revision wise. Even though you done MSK and right now you are neuro with me, don't forget your MSK. Let's go with the neuro. Any question, MSK? I'm just giving superficial ideas. Good. Simran, question?
No, ma'am, good to go.
Good to go. Let's go. Neuro. Neuro, I drop. I see this thing. Patient-centered approach. This is my patient. Neuro, everything in the Sullivan. Okay, from student point of view, chapter number 2 to 8. That is the assessment chapter. I want every time, like once you're gonna read it, it's too much. So don't read too much. I'm gonna explain that what you're gonna read. Once neuro will start, I'm opening the book in front of you and I'm gonna say that, okay, this is important. Second thing is neuro. What happened, what I observe in the student? Neuro, for example, Parkinson. Okay. So students are very thorough in the Parkinson, basal ganglia, direct pathway, indirect pathway, if they are very enthused. In exam, you end up with the scenario. In the exam, they are not saying that, okay, how the dopamine is working. It is not our scope of practice. What is our scope of practice? Physiotherapy. So condition, read it, thorough it, pathophysiology one time, symptoms as per the disease, you must know. ALS, proximal muscle weakness, distal muscle weakness, where to start, spasticity, flaccidity, UMN, LMN, everything you must know. Spinal cord injury, T6 versus L2, what is the maximum functional level? You must know as per the disease. But then PCE point of view, what is your thorough aspect is physiotherapy assessment and physiotherapy intervention. Both is the important. If you don't know how to check this spasticity versus rigidity, that's not good. Scale, fatigue, modified fatigue impact scale, balance, Berg balance scale. Now in that balance scale, that balance is used for static and dynamic balance only. It's not checking mobility. If there is a mobility, maybe observational gait analysis. Time bound, time up and go. So your assessment must be thorough. Word wise, wording is important. It's not like I know time up and go test. No, wording is important. FIM, functional independent measure. Now that evaluate ADL assessment, communication, cognition, functional independency. So these 4 words are important. It's not only just functional independency. So this is your concept for the topic. Intervention, focus on the point. Now neuro is different than MSK. Neuro, sometimes condition is deteriorating, sometimes condition is plateau and then recovered. We don't know. GBS, extremely ventilator patient, then able to walk and run. Spinal cord injury patient, the level never recovered. Parkinson patient, initially dopamine, they are completely back to the neutral, then gradually deteriorating, end up with the hospital, and then they are end up with the pulmonary stuff. So intervention, focus on the point. Goal here, multi-team approach, physician, nurse, OT, occupational therapist, speech language pathologist, dietitian, psychologist. I didn't put all the names, neurosurgeon and all this thing is there. So neuro, interesting, plus understanding, then it is easy. Only like you are going with the condition wise, this is not enough. Neuro intervention, maximum functional level, work on restorative, preventive, or compensatory. So depending on the scenario. Small things to focus. Skin care, pressure source, patient as a GBS. He is getting worsening, is not yet to plateau. Not yet to plateau means he is still going on the like deterioration. At that time, what is your goal? To prevention of the secondary complication. So that way you have to be remembered. Parkinson patient, DMD, Duchenne's muscular dystrophy. So these patients end up with the pulmonary stuff. And that is the reason for the death. So in the late stage, what you're going to do? You're going to work on the pulmonary, breathing exercise, spirometry, secretion removal technique, suction, depending on the patient scenario. If patient is wheelchair bound, wheelchair management, pressure relieving, wheelchair, appropriate wheelchair, like independent in wheelchair. So neuro is intervention is must. Assessment and intervention. Any question? Let's go with a few things in cardiac. Cardiac physiological response, like normal physiological response was what is heart rate, BP, what is the Valsalva maneuver. Very important to understand the basic thing first. ECG, respiratory rate, oscillatory findings, pulse. You know what is the sign of hypoxia? How to evaluate? So cardiac patient, cardiac condition, it's easy. Cardiac conditions and then cardiac rehab. Almost cardiac rehab are same because we are not the physician that we are changing the medication. We are the therapist. So cardiac rehab is always done with the 3 phase. Hospitalized patient, phase 2, discharge from the hospital, and phase 3 means community. Those who are going for the gym. Even I am going to the gym, I am a phase 3 cardiac patient because I am going for prevention of the cardiac disease. So these phases are important. Every phase, detailed cardiac rehab, we will explain, like I will cover in the cardiac lectures. MET, metabolic equivalent quotient, exercise tolerance test, rate of perceived exertion, and heart rate. That 4 terms are used for the intensity. Same like those doctors have prescribed medications, we are prescribed exercise. So in that one, intensity, frequency, time, and type. Fit criteria, every therapist must know. And that cardiac associated with the neuro, associated with the THR patient and the aerobic capacity. So in the THR patient, hip does not go beyond 90 degrees. So regarding the cycling, keep the seat height elevated. So that portion is like, very, very important. Pulmonary, again, pulmonary system, pulmonary changes, rib cage, bucket handle movement, pump handle movement, caliper actions, breathing pattern, thoracoabdomen, abdominothoracic, muscles, I didn't put it here, diaphragm, innervation of the diaphragm, diaphragm role, abdominal paralysis and diaphragm and abdominal paralysis, everything is it's interesting actually, but your mind concept is clear that, okay, this is thing, now patient is going toward this side. Pulmonary function test, auscultatory finding, respiratory rate, SpO2, partial pressure of oxygen, partial pressure of carbon dioxide, HCO3 minus, ABG, arterial blood gas analysis, pulmonary assessment, pulmonary condition. It's very, very, very important. Condition, you must know. If I'm saying bronchiectasis, what is the X-ray changes? What is the auscultatory changes? What is the postural changes? What is the patient's clinical presentation? If 4 things is clear, you are good to go. And it is not hard. Only right now you are not go through that. That's why. Otherwise, toughest thing to coming out from the mother's womb. That is the toughest thing that you did it. So now it is easy. Everything is easy. Only you have to read it. Pulmonary rehabilitation, that I just elaborate a little bit. If patient is coming with the pulmonary rehab, so you can start with the ETT. Otherwise, pulmonary, you must know about breathing exercise. In that one, deep breathing exercise, diaphragmatic breathing exercise, pursely breathing exercise, inspiratory muscle training, glossopharyngeal breathing exercise, incentive spirometry, all associated with the breathing. They have their own role. They have their own significance. You cannot give inspiratory exercise to COPD patient. They are already hyperinflated. Then patient has the secretions, postural drainage position. In that position, you can give percussion, vibration, active control of breathing technique, coughing, huffing, condition-wise, suction, precaution, ethics. Before suction, you must wear the gloves. Ethics. Mechanical ventilation, ventilator patient. Now, pulmonary GBS patient on ventilator. Then you have all question of pulmonary stuff. For example, Parkinson patient having a pulmonary complication. You may give the upper extremity D2 flexion with the breathing exercise. So depending on the scenario, your treatment is changed, but you have to be aware about everything. Any question? Next, pedia. Pedia, again, normal development, which is month-wise. 1 month, 2nd month, 4 months, 6 months, 8 months, 1 year, 2 year, 3 year, and 5 years. Up to 5 years, we have to be remember. Normal development, reflexes, neonatal assessment, developmental delay, particularly in the pedia, abnormal, like delayed babies and the posture. Conditions, pediatric ethics, neuro condition. In the neuro condition, baby has a respiratory distress syndrome in the babies. So this type of the pulmonary conditions, other conditions, CP, ataxia, athetoid CP, spina bifida, Down syndrome, DMD. So these are the other conditions in the pedia, and assisted device and orthosis for the pedia that we will cover in the pediatric lecture. So that is your pedia. Geriatrics, most important physiological changes, because geriatric populations are different than the younger generation. And all the system, pulmonary, skin, cardio, MSK. So that geriatric may be Parkinson patient, Alzheimer patient, sorry, Parkinson patient, ALS patient, MS patient, they are age related. So they definitely enter into the geriatric population, but that covered in the neuro lecture, but few geriatric conditions which is different. So it's mostly seen in the geriatric age only, and that is mainly Alzheimer, dementia, delirium. So that I covered in the geriatric lecture actually. And then all, heart attack, CABG, cardiac transplant, everything is later in the life. So it is a geriatric population. Any question? And finally, others have a lot of topics, approximately 30 topics I didn't mention here. But major topic I just put it: burns, pregnancy, modality, assisted device, hormonal, thyroid, parathyroid, adrenal, corticosteroids. So like, the hormonal changes and the physiotherapy point of view, clinical application, diabetes, obesity, metabolic syndrome, skin condition, psoriasis, scleroderma, systemic lupus erythematosus. So these are the skin conditions and all. Mostly therapy at chapter number 5 to 11, everything is covered in other system. Sullivan, it is also covered in the other system. Now Kushi is joining me. So these are the other systems. Other systems also, you may get the questions with the MSK, with the cardiac. For example, patient having a pregnancy and carpal tunnel syndrome. So pregnant lady, we have to think we cannot give modality. Carpal tunnel, we cannot give ultrasound. So here we are giving splint only. Pregnant lady and the sacral pain. So uterus, babies are there. Positional changes, we cannot give supine line more than 5 minutes after 13 weeks. So that type of the things, you get associated questions. Clear? So this is the other systems. And most PCE, ethics. PC is all about ethics. Mostly my lectures like 12 I am saying, but this March batch I have a 15 lectures. So 12 and more lectures for the ethics. And I also in the lectures, particularly regular lectures, I focus with the ethics. That okay, go with this ethics. Always think for the ethics. Preparation, theoretical concept, question answers makes you more confident before going for your exam. But if you are not doing question answers, try to solve the question answer as possible as, but on the other word, don't go with the useless questions. Because I come across with the question, I'm like, these are the not PC questions. We are not saying where is the carpal bone, third carpal bone is situated. This is not a PC, it is a practical scenario. Okay, so yes, we have to do the as much as possible questions, but that is also our critical scenarios. We have to think our critical thinking way, question answers, even though you are giving 12 marks, but it is not appropriate. Instead of that, only you are giving 2 marks, which is appropriate. So weightage is 2 marks. So smart, perfection, and you evaluate yourself that where I am going. You have to go with the thorough direction. Every lectures I am taking it. I'm not like, it's not like other persons are taking it. I'm covering the lectures. I'm trying to provide all the details. Even though it is related to the, I'm conducting the lecture, for example, wrist joint. But carpal tunnel comes, I definitely say that carpal tunnel, you have to think for pregnancy. So that way I'm trying to cover it because in mentoring, it is my less work. So whatever points I'm mentioning in the lectures, even though it is not in my PPT, I'm mentioning with the lectures, delivering lectures. Write it down every time. Any question?
Ma'am, do you provide a timetable like for the particular lectures on which day, which lectures?
Yes, yes. So I'm providing short-term timetables. 15 days like that way. So it's easy for me and easy for the students. And
Okay.
if you are asking me about the overall like system-wise, first I'm covering MSK. Then neuro is big. So in between, I'm trying to cover cardio. Cardio is only 5 to 6 lectures. Then pulmonary, because it is the associated stuff. And then I'm going neuro plus other system. So it's neuro is like, monotonous. So neuro big topic, then one small topic, big topic, then one small topic, like that way. And ethics, it is whenever I'm conducting the classes, I'm gonna conduct, like you have to enroll. So ethics is not like maybe when I'm pulmonaries, I'm going on, in between we have ethics classes. Ethics classes every weekend generally, because that I'm gonna deliver with the for the other students as well who only purchase the ethics with me. So ethics mostly weekend classes. Mostly other classes are 3 to 4 times in a week, minimum. And after that, PDI and GDI. Okay. Any other question?
The timing will be around 6:30 a.m. 6:30 a.m. to 8:30. Yeah,
Timing is
okay.
around like that, but after like, there is a, yeah, approximately 6:30.
Okay.
Any other? Books I already mentioned. So go with the preparation. A PC is not like whatever, see, yeah, do not follow others. Be your own rider. Like, sometimes, students are gathering everything. Gathering everything does not clear your concept. Your active involvement clear your concept. You have this material, this thing, lot of thing. First of all, I'm not delivering too much thing to the students initially. I'm providing everything, but system wise. Because if I'm providing that, okay, you have to do this, you have to do this, you have to do this, then if you are going with one shop and you have a multiple choice, then you are not selecting what you want it. So I don't want that mistake from you guys. Do not follow others. Be your own writer. Yes, you are enough mature that you understand what is wrong, what is right. Even I'm going in the right way, I'm going in the wrong way. I'm not saying that. I'm not saying that blindly follow. Follow with your mind, but you are not uh, under the influence of others' impression. Because sometimes you are thinking that no, he already passed. He passed. He is doing on preparation. Maybe he is not revealed what he is doing. You have to do without your reading, without your concept clear, and without the question answer, you are not clearing PCE. That is thumb rule. You have to, like, you are a physiotherapist, so you have to know what is the condition. You are not just only going with the question answer and you are cleared. And you are only going with the theory and you are cleared. So be your own writer, focus on your path, make your own timetable. Even in my students, between the students, some students are fast, they are with me regularly, and some students are way behind. So I'm not for that also, because their capacity is not there. If I am saying Vedant versus Forum, example. So Vedant may be slow, he is taking some time to understand the concept, but once he understand, he never forget. Forum, she is fast to do it, but then she has to do revision again and again. So both are different. Everyone is unique. Even me, I am unique. I have like different way I have to prepare myself. I am not like, no one is perfect. No one is perfect. So your speed, but do not too slow and do not too fast. Sturdy. Clear? That is a PC. That is a global physio, basically. And I'm providing this thing for the PC written. And all the classes, all the students are PC students. NPT, I have a batch of NPT, but that is totally different. Because NPT is totally different. PC is totally different. I don't want to merge both the things. PC, I'm going to conduct with the PC point of view. PC ethics, what I'm delivering in lecture, I cannot deliver in NPT lecture. And if I'm not delivering ethics with the topic, students may end up with some lacking portion. So ethics is associated with the topics. Okay. Any other question? So be ready, 25th April, our first class, that is the shoulder joint. Okay. So if you want to read from the Kishner, read from the, like Kishner is the best book, and Maggie. For the Maggie, yes. Initial applied anatomy, the arthrokinematics is very well explained, but it is too much. So if you want to go through me, like after my lecture, read it, whatever you want. And Kishner, just go through superficial idea. Kishner is the best book. 7th edition, I preferred. It is a really nice book. So go with that. Clear, Simran?
Yes, ma'am.
Any question? Vedant?
No, actually, right now I don't have any kind of book, so I have to order.
I will call you. I will call you.
Right.
Today actually sorry for the group because by mistake I did wrong timing. But anyways, this is the recorded lectures. I'm posting on the YouTube as well for the getting the idea to the other students also. So you can have access. And I'm gonna call personally also for the students for the preparation for that. So don't worry.
Okay.
Good to
Thank
go. Enjoy. Okay, have a nice
Thank you.
weekend. Bye. Take
Yeah,
care.
you too. Bye.